At McMaster University, our family medicine residents learn to care for individuals, families, and communities. We provide a robust training experience grounded in continuity of relationships that supports resident well-being and builds on a history of leading innovations in medical education. McMaster's Family Medicine Residency program puts the resident at the very center of its curriculum.
We seek out input from our residents to help inform ongoing program decisions so we can offer a training program that's optimized for everyone.
I think one thing that I realized in residency is how important it is that the people around you care about you. The preceptors here, whether or not they're primary preceptors or they're preceptors in the hospital, they truly are invested in our learning. They care about you as a physician, but also your goals in the future. They want you to learn so that you can be as competent as you can be.
Clinical and academic experiences are structured to build competence and prepare graduates for comprehensive practice anywhere in Canada.
I'm really proud of how the Department of Family Medicine prepares our learners for a successful career in family medicine. We have tremendous clinical facilities with very varied patient populations, so we're preparing people to care for all members of society. We value self-directed learning and being a coach and a supporter in a resident's learning journey. So whatever their starting point, we give them the tools, the clinical facilities, and the support to see a variety of patients so they'll feel confident practicing anywhere they choose to when they're done.
Our program is organized regionally so residents can train, work, and live in a community that suits their goals as a family physician.
Residents have an opportunity to choose from one of our diverse training sites, 6 being urban and 6 rural. Our communities are connected, and residents, regardless of training site, have access to a well-designed core curriculum, including both clinical and non-clinical experiences.
For me, choosing McMaster to train rurally really was different than a number of other schools. You had the opportunity to be very close to larger centers while still having a rural practice and a rural community. So if you wanted to do all of rural, you could. If you wanted to do a little bit in those larger centers, you also had that opportunity as well.
Residents also have a clinical home base for the 2 years of the program, with one family physician as their primary preceptor. This model provides continuity of care, mentorship, and education to our residents.
So I think teaching is far more satisfying when it's relational and occurs over time, and it's incredibly satisfying at McMaster to see the whole arc of the development of your residents from day one to being a fully fledged independent practicing physician at the end.
I think the resident-preceptor dyad and the continuity it provides, the longitudinal nature of the relationship, that creates a good opportunity to identify gaps and provide feedback. My preceptor has been a great mentor to me, and I think she will be for the rest of my career.
So the program has been structured in such a way that it allows for residents to take on independence, push themselves, but still have the support to do so safely, so that when residents finish our program, they really have the confidence to step into independent practice.
The learners who choose McMaster Family Medicine have a curious spirit. We provide the environment and the mentorship of expert faculty for residents to build a broad skill set that honors their curiosity and interests. Residents with a research interest may collaborate with our research enterprise for opportunities to create and share new knowledge at a larger scale.
At McMaster, we embrace asking questions, and that's what the inquiry curriculum is meant to address. Our residents will graduate feeling confident in their ability to use information and be a knowledge user, as well as being a knowledge contributor.
Every resident needs to participate in our scholarly curriculum, which is called IQ. That curriculum is designed to introduce everyone to the principles of quality improvement in family medicine and to evidence-based practice. So when I started residency, I was able to have a meeting with the Associate Chair and Director of Research for the Department of Family Medicine, and then again in my second year I met with them. And it was really helpful in terms of getting some feedback on what were the things I needed to do in residency in order to prepare myself for the career that I wanted as a researcher.
Our mental health and behavioral sciences curriculum goes beyond a typical psychiatry rotation.
Over the course of 2 years, residents meet weekly and cover the core content of psychiatry, psychopharmacology, with a strong emphasis on patient-centered care. One of the more unique things about the program is the fact that they're with the same group of 8 to 10 residents and 3 faculty members, a psychiatrist, a family doc, and usually a social worker, over the course of the 2 years. So during those times, they can form quite strong bonds, and these are people that are sharing the same lived experiences and journeys as each resident.
I really believe in the work-life balance and making sure that I'm feeling well supported in my clinical duties as well as outside of work, and being able to see the same faces throughout my residency year is really important for me, and I think is very unique to McMaster, because a lot of the residents that end up coming here are open and friendly, and we're able to see the same individuals throughout our 2 years here, and that builds relationships and builds colleagues that we'll hopefully have as we prolong our career.
At every level of the resident experience, McMaster's culture of innovation creates an open, dynamic environment where structured and informal mentorship helps residents develop the skills they seek.
Our faculty at McMaster are committed educators who invest themselves not only in the care of their patients, but also in the care and teaching of residents in our program. As creative innovators, they contribute not only to a resident's educational journey, but also to interesting research opportunities and to innovations in the clinical sphere as well. Residents are core members of our healthcare teams, contributing to the care of patients and communities in meaningful ways, while being safe and supported with appropriate supervision and access to simulation and other training opportunities to help them gradually build skill and move in a graduated fashion towards independence.
Our graduates are dynamic, adaptable leaders in their communities, in primary care, and most of all, in caring for people.